Welcome, everyone. We're so glad that you could be here with us tonight for this important conversation. We have some great experts lined up who also happen to be parents and grandparents in the Cajon Valley Union School District and also beyond the district. Many of us, including myself, have children in this age group of 5 to less than 12 years old who've recently been authorized to get the vaccine. My name is Mary McKenzie. I work for ABC 10 News. I'm an anchor and reporter. I anchor on the weekends and I report during the week. And I've been covering, of course, the pandemic since it began. But again, I'm also a mom to two little ones who fall into this age group. So I am thrilled to be part of this conversation, this dialogue tonight. Hopefully, we can answer some of your incredibly important questions. We know that your children are the most important things in the world to you. So we want to make that with transparency and honesty and openness, you get some of your questions answered, and we do our very best to bring you as much information as we possibly can in the hour that we have with you. And with that, I'd like to introduce Dr. David Miyashiro. He's the superintendent of the Cajon Valley Union School District. David, you're also a parent, and your daughter is in this age group. So if you can welcome everyone on the panel and talk about how you brought us all together.
Thank you. Our daughter's watching. She's 9, so hi, Lane. And yes, in March 2020, when we had to shut down our schools, we started weekly town hall meetings with all of our parent leaders. And after the first few weeks, when we realized that this may go on for quite some time, we started to hear from parents that this is not going to work for us. We both need to work. And Pauline, who's on this panel, is a parent at Fuerte. She's the director of nursing. Her husband's in law enforcement. They both needed to go to work and didn't have a solution for not just distance learning, but childcare. So we wanted to open our schools for free care for essential workers. And we didn't know how to do it because it was April 2020. And Christian and Pauline and John, we leaned on our healthcare providers right here and asked, how can we safely open schools? And since then, we've done 2 panels together on how to open schools and showing why opening schools is more safe than leaving children home in isolation. And that's really how the panel started. And Derek and I did a panel last month on the digital divide, and we discussed having him participate and bringing in the entire parent community in San Diego and Imperial County. So we're really grateful for this panel for their time and expertise. Volume.
Can't hear you.
I muted myself to try and keep myself from having any background interference. Of course, I did it too soon. I want to make sure we introduce also our experts tonight, Dr. John Bradley, Dr. Christian Ramers, both physicians, and Pauline Lucatero, whom you mentioned, as well as Derek Berner, who's here tonight. We want to give you each a chance to say hello, kind of talk about being parents and the little bit of background that brings you here to this panel. Dr. Bradley, why don't I start with you? John.
Thank you. I'm a pediatric infectious disease doctor. I've been in San Diego at Children's Hospital, now Rady Children's Hospital, for 33 years. And I feel like I've spent my entire life training for this particular pandemic. I've got grandkids here, and my daughter-in-law is incredibly paranoid of COVID. So it's like calming her down, telling her where it comes from, all of that stuff, in addition to working at the hospital and sharing weekly information with all the healthcare workers at our Rady Children's Hospital. So I am honored and delighted to join you this evening to share everything that I know about COVID and the vaccines. Thank you so much, Mary and David.
Excellent. All right, Christian, Dr. Ramers, we'll let you say hello next.
Thanks, Mary. I actually met John in 1999 when I started in medical school at UCSD. And at that time, my wife was a teacher at El Cajon Valley High School. That's where we got our start. I trained in pediatrics and internal medicine at Duke University, and then went on to adult infectious diseases. And I've been back in San Diego for the last 11, 12 years at Family Health Centers of San Diego, and living and breathing COVID really for the last 2 years. It's just taken over most of what we do. And I'll just add that as a parent of a 13 and a 16-year-old, we see this from different perspectives. But when we go to work, we also see all the consequences and all the things that go wrong from COVID. So we bring that knowledge as well. But thank you so much for having me.
Pauline Lucatero, Director of Nursing for Family Health Centers of San Diego. Why don't you say hello? And you have 2 kiddos in the district, is that right?
I do, Mary. Thank you so much for the introduction. My name is Pauline Lucatero, and I am the Director of Nursing for Family Health Centers of San Diego. But more importantly, I'm also a mom to a 9-year-old and an 11-year-old from Fuerte. So this is how my connection with the Cajon Valley School District in relationship with and working with Dr. David Miyashiro. And just like what Dr. Raymer said, we do go to work, and we have been dealing with COVID positive patients for the duration of this pandemic. So, my family's worried every day that I come home, whether I bring it home to them. So that's important. I want to share those stories with you guys. Thank you.
We're looking forward to that. Pauline, thank you so much. It's such an important part of the conversation. Derek Berner, will you say hello? Our local PTA president for all of San Diego, Riverside counties. Introduce yourself if you would, please.
Yes, thank you, Mary. So my name's Derek Berner, President 9th District PTA, so it's San Diego and Imperial counties, real close. And if I can actually quick change the subject, since we are here on veterans, say thank you to all of our veterans on behalf of everyone on this panel. We appreciate you. So this is exciting. I'm a parent. I'm a volunteer. I am not a medical expert. So I've had to rely on medical advice for my children. I have a 12 and a 16-year-old. My wife is also a teacher. So we had similar challenges like every other parent out there. So we're excited. I'm excited on behalf of PTA to bring the questions that parents have throughout these counties to our medical experts and help get some of those questions answered. So we appreciate it. Thank you.
Excellent. Thank you, Derek. We want to jump right into it. We have received some fantastic questions already from you at home, from parents that have weighed in with their thoughts and want to ask our experts. So why don't we start with Karen? I think we have a video question.
I'm Karen Rand, and I have 3 children. One is between the ages of 5 and 11. And we are really debating on whether we should let all our kids get the vaccine. I have yet to have a clear understanding of the data of the risks of COVID and the vaccine. So as medical professionals, I ask, can you share some data that will help me evaluate the risk of the side effects of the vaccine versus the risk of COVID itself?
Hi everyone, my name is Maham, my daughter with Los Coches Middle Greek School. I have just a brief question. If my kid's very healthy, and a lot of kids I know is very healthy, good immune system, do we need to do a vaccine for them? So please approve that with any data you can, if you could. And in another way, we can consider this vaccine, or we have all the right to say apologize. Thank you.
Okay, so Christian, I know that was a lot. Why don't we begin with you? I think what a lot of parents clearly are looking for, it was the through line and some of the questions that we received, is some of the data behind the vaccine, what we know about this age group.
Great. Shall I start with slides or? Yes, there we go. Okay, excellent. So I'm going to run through these fairly quickly, and they're very visual. So just some basics about SARS-CoV-2, which is the virus that causes COVID, some epidemiology, understanding what's actually happening in our community. And then I'm going to finish with COVID in children and then pass it off to John to get a little more into the specifics of the vaccines. Next slide, please. So the basics of what COVID is, it's a disease caused by SARS-CoV-2, and that's a virus from a family of coronaviruses, which normally just cause colds. Coronaviruses cause 30% of all colds, and they have these names like NL63 and OC43. And so our knowledge of coronaviruses up to this point had been confined to those. But recently there's been these more dangerous coronaviruses. The first one was called SARS, Severe Acute Respiratory Syndrome, in 2002 in many Asian countries that killed a lot of people there. And then came MERS, the Middle East Respiratory Syndrome, 2012. That actually jumped from camels into humans. And then in 2019, we had SARS-CoV-2 that jumped from probably some intermediate mammal from a bat into humans. And of course, we've been living and breathing this ever since. And then COVID-19 is just the name of the disease that virus causes. Next slide, please. So we've learned a lot about how this disease is transmitted. And to be honest, in the beginning, we weren't really so sure. It was kind of inaccurate. We thought that you could get it from touching door handles and groceries and that type of thing. But it looks like there's really two ways that explain almost all of the transmission. And one is through what's called droplets, which are the ones that kind of go down and fall to the ground, usually within 6 feet of after you're speaking or singing or talking. And then we've recognized more and more that actually aerosols, which are smaller little droplets, can travel a little bit further and really give the virus kind of a free ride. We can go to the next advance there. The virus itself isn't really traveling by itself. It's actually, nope, sorry, go one back, there we go. It's actually hitching a ride in these different size aerosols and droplets. And so what we know about ventilation and masks has a lot to do with this concept now about how the virus is really traveling from one person's lungs into another. Next slide. The timing of how this disease looks is really kind of tricky. So we're used to seeing a 24-hour news cycle, but it really takes almost a month in a person who eventually gets sick and dies of COVID from getting exposed, becoming symptomatic within about 5 days, maybe getting a test over the next 3 to 4 days, and then symptoms for 7 to 10 days, and then requiring hospitalization. And then adults at least spend 2 to 3 weeks in the hospital, usually before they die. We could advance one, please. We've learned some really interesting things, which is at the beginning of the disease where you have these flu-like symptoms are mostly caused by the virus. And when you reach about day 10, the virus is almost gone in most people, and it's the immune system itself, an over-exuberant immune system that really causes much of the damage that you see in that picture of someone's lungs over there. And advance one more, please. And one of the most mysterious things of all is that some people have extremely mild disease, up to 80%. This is from the original cohort in China. And then about 15 to 20% of people have more severe disease, and we are not very good at predicting who that's going to be. Next slide. Now, we know for sure that age matters, and the older somebody is, the more likely they are to die. And of course, less than age 55, you get down into the 1% or less type of range. But again, this is highly variable, and there are many other factors that are important. We advance one, please. Obesity turns out to be a major factor in who ends up having trouble and dying. And what this kind of complicated graph shows you is that for different body mass index levels, where normal is about 18 to 25, every 5 points that you go up, you have a higher risk of being hospitalized, of being admitted to the ICU, of having a mechanical ventilation, or dying. So being unhealthy and being obese is absolutely a risk factor for having trouble with COVID. Next slide. We also know that having underlying medical conditions, especially multiples of them, does set you up for having a trouble with COVID. And then one more slide, please. And it looks like hospitalizations and deaths are much, much more likely in people that have underlying conditions, such as cardiovascular disease, diabetes, and chronic lung disease. Putting this all together and bringing it in the context of kids, the two most common conditions in kids that are getting hospitalized with COVID are asthma and obesity, which are actually incredibly common conditions and really not considered rare. Next slide. Another really mysterious part about COVID is this thing called long COVID. And as a clinician, as a doctor seeing patients in clinic, this is the most frustrating thing for me and for the patients, that they survive COVID, some of them with a very mild case, and then their lives completely change. And they can no longer run, or they can no longer work, or they have trouble sleeping, or their heart starts racing for no reason. We really don't have a great understanding of what this is. And it looks like it affects 10 to 30% of adults. And a study just came out of England saying it's probably about 7 to 8% of kids with COVID. And it may not have anything to do with how severe the original infection was. Next slide. And one more. Okay. So I'm just going to show you some pictures of the world, just to give you some general idea. We're over 250 million cases, 5 million deaths in the world. And this one in green is quite impressive. There have been 7 billion vaccines that have been given in the world. This is the largest vaccination campaign that has ever occurred in the history of humanity. So we really have a good idea of what these vaccines are and what they do and what their side effects are. Next slide. And it's probably true that that's an underestimate of how the impact of this disease is. 5 million cases of deaths have been reported, but some people estimate it's more like 16 million, especially in some countries that aren't doing a very good job of reporting. Next slide. In California, and you can advance 3 times so we can see all the numbers here. So in California, we've seen what a lot of other places have seen, which is that a lot of the cases, a lot of the hospitalizations, and a lot of the deaths are concentrated in people who have not been vaccinated. So while it's not true that vaccines protect you 100%, they dramatically reduce your risk of having a case, of being hospitalized, or of dying. Those red lines are amongst people who are unvaccinated, and those blue lines are people who are vaccinated. Of course, the blue lines are not flat at 0, but they're just a whole lot lower than any of those other red lines that you see there. Next slide. And this has been true in San Diego as well, in terms of cases and hospitalizations and deaths. And just to give you some actual data from our percentages, 75% of cases in San Diego since March have occurred in unvaccinated folks, 93% of the hospitalizations, and 85% of the deaths. Next slide. Okay, I'm almost finished. I'm going to finish with COVID in kids. This is a big debate. So, the survival rate is so good in kids, the death rate is so low. Is COVID really a problem? So, as an infectious disease doctor, here's what I look at. What about transmission? Are kids involved in transmission? What do the case numbers look like? How many hospitalizations occur? Those are kids that are generally sicker than just typically having a cold. What about deaths? I mentioned long COVID, and then I haven't mentioned this yet. I have a slide after this on MIS-C. I'll get to that in a second. Advance the slide, please. So we do know from studies that kids that are above age 10 can transmit just as efficiently as adults can. We've seen about this slide is already out of date. It's about 6.5 million cases of COVID amongst people that are under age 18. And even when you have a death rate that's very, very low, such as 0.007%, when you do the math, that results in a lot of sick kids. So 65,000 kids have been hospitalized, about a third of those requiring ICU level care. 805 kids have died of COVID. And then this long COVID number, I mentioned 7 to 8%. And multi-system inflammatory syndrome in children is a really mysterious kind of disease that actually it's a provoking of a kid's immune response where it makes them very sick, and it's occurred at least 5,000 times in the US, and there have been 46 kids that have died of that condition as well. Next slide. And here's actually just the death curve. As you can see, kids that are less than a year of age are highly vulnerable to dying of COVID, and they're very vulnerable and depending on those around them to protect them. And then those who get more in the adolescent range tend to have more obesity and asthma, and so they're vulnerable as well. But even in this 5 through 11 year range, there's been about 94 deaths of COVID-19. Next slide. And I'm almost finished. This multi-system inflammatory syndrome in children you may not have heard of, but it's a very dangerous condition where the immune system starts acting very hyperactive, tends to occur 2 to 6 weeks after a case of COVID-19. It doesn't occur very commonly, but 1 in 3,000 or so. Again, do the math of 6.4 million and you get a big number. And a lot of cases require ICU level care, and kids can actually die of this as well. And as you see on the bottom right, this actually is concentrated in the age group of age 5 through 11. And next slide, I think, is my final or next to last slide. So I am a parent. That was my daughter flashing before they're getting her Pfizer vaccine as soon as she possibly could, and wanting to get back and be with her friends safely and everything and go back to school. She's at a public school in San Diego as well. And then finally, I just want to make one last point, which is that none of the things that we are looking at to help with this whole pandemic are foolproof. Masks aren't foolproof, vaccines aren't foolproof, ventilation's not foolproof, distancing isn't foolproof, and lockdowns are not even foolproof. But the combination of them together gives us the best chance at reducing caseloads, keeping our schools open, which is really what everybody wants for our kids. So I think I went a little over time, but I'm going to pass to you, John.
Thanks so much, Christian. You did all the heavy lifting. I'm glad that you had all of the information, so I won't repeat it, but I have a set of slides, a little bit of overlap, but not too much. I'm going to focus on the vaccine, but I was also asked to talk about what the infection is and how the vaccine is made from components of the virus itself. So if you could pull up my slides, please. I know what they say, but I haven't memorized them all. Here we go. Okay, next slide, please. So, one back, please. So as Dr. Bamberts mentioned, there's a virus that causes COVID. And I want to make some parallels with influenza. It's about the same size as influenza, And as Christian mentioned, you get it from the air from someone around you who is infected. It's the congestion, coughing, sneezing, singing, yelling, that sort of thing. And if you are symptomatic with disease, you're much more likely to spread it than if you have the infection and you're asymptomatic. The virus doesn't go in the air particles nearly as much if you're not coughing and sneezing, and just a little bit of talking is not so contagious. The virus, once you breathe it in, lands on the lining cells of your nose and throat and infects those cells. And in the electron micrograph pretty picture in the upper right, you see the little green protrusions off the virus. That's the spike protein that everyone keeps talking about. And that's in the cartoon figure just below that. And the spike protein is in red. And the spike protein is how the virus recognizes your cell and attaches to it for an infection. So the spike protein is essential for an infection to occur. And you can see the spike protein attaching to a specific receptor, an ACE2 receptor. So it takes a receptor that the body uses for another function and hijacks it and binds to it so that the cell then takes it in. Next, please. So the vaccine it makes your body think that it was infected because the vaccine is spike protein only, not an active virus. And what we've done is taken the RNA inside the virus, and as the virus infects your cell, it takes over the cell and it gives the cell instructions to make new whole viruses. But if you just take out the segment that has the spike protein with no whole virus, then there's no risk of any virus infection from the vaccine. But you can take out that part of the RNA and then encapsulate it and use it for the vaccine so that only the spike protein instructions are given to your body, not the whole virus. And so your body looks at these instructions and your body makes spike protein, coronavirus spike protein. Your immune system recognizes that as foreign. And so your body creates immunity to spike protein. Next slide, please. There's two ways that your body makes immunity to the virus. One is antibody, which is a protein, a specific protein. And the other is lymphocytes, cellular immunity. And the antibodies are easily measured, pretty inexpensive. So that's what most of us recognize. So these antibodies against spike protein that your body makes are circulating in your bloodstream. So that if coronavirus, SARS-CoV-2, should land on one of your cells, your antibodies are recognizing that, and you form an immune response to prevent that virus from causing a productive, serious infection. So like every vaccine, the longer you go from the vaccine, the more your body thinks it doesn't have to worry and make antibody. So that when you get re-exposed, it takes your body a bit longer to re-engage the memory and respond. From this particular slide, you can see that the proteins stick to the antibody proteins, stick to the spike protein. And if all these spike proteins are covered, then the virus can't recognize any of your cell and it can't attach and it can't infect you. So antibody is a specific way that you are protected from infection. Next, please. So the vaccines are pretty safe, and as of Monday of this week, 239 million people in the US have had at least one shot, and we've collected a tremendous amount of data, and we know that these vaccines are among the safest vaccines that we have in use. And also, as you probably know, between 900,000 and 1 million children between 5 and 12 years of age have already received this vaccine. That was just EUA authorized on the 2nd of November. So we will have plenty of data in a very short period of time on the safety of vaccines in this particular age group. And I want to specifically tell you that in these studies, the vaccine is safe. In the previous studies in the adolescents, there was some incidence of myocarditis, inflammation in the heart, and the CDC and FDA are tracking that. And I want everyone to know that there have been no teenagers in the United States who've died from any vaccine side effects like myocarditis. And in fact, half the cases that have been reported, when they get investigated, and we've reported 15, the CDC calls us, we give them the records, and not all of those cases are actually vaccine associated. A child can have another cause of heart dysfunction and have been given the vaccine, and the two are unrelated. So the risk of myocarditis after vaccine is actually less than what the original reports suggested. So we've taken care of about 15 kids who we thought had myocarditis out of about 200,000 12 to 18-year-olds who have been vaccinated in San Diego County. Really, really low, much less than coronavirus itself or the inflammatory syndrome that Dr. Ramers mentioned, MIS-C. And I also want to stress that none of the 3,000 kids that got vaccine in the studies that led to the FDA's authorization, none of them had any heart problems. 0 out of 3,000 had myocarditis. So at least we know it's not a frequent side effect, but we suspected it wouldn't be a problem because most of those side effects are in boys, in adolescents, and young adults. So it's after you turn from a child into an adult where this vaccine side effect begins to occur, but it causes much less problem than COVID itself or MIS-C, as I think I'll show you on the next slide. Yes, so this is information from the CDC's big session on November 2nd. All of this information is available on the CDC website, and you've got access to that. So on the left side, it just shows you how many cases are prevented for every million cases vaccinations given. And every case of hospitalization we can prevent is important. And just like Christian, I've got grandkids in San Diego who got vaccination the first day it was approved. So there's my granddaughter. I'm so proud of her. And I think I'm wrapping up, and we'll get back to Mary. Oh, this just shows that the vaccine is protective. Won't need to go into that. It works just as well as the vaccine works for adults. And yes, thank you.
That's perfect. That was great. John, Christian, thank you so much. We have a lot of really good questions coming in tonight. Many of them kind of follow and mimic what we have seen in the days leading up to this panel. We had asked you to come up with questions, as you saw a couple of the video questions that were submitted. So I'll take one from Facebook. There are some Facebook Live viewers who have asked, Jessica, Nikki, and Unique all want to know more about the long-term effects of the vaccine itself, not so much COVID, but from the vaccine. And I don't know if John, you would be the better person, or Christian, which of you would prefer to answer that?
I'd be happy to give it a try. We don't have long-term 1 to 2 year follow-up data for children. The vaccine for adolescents was recently authorized a few months ago. The vaccine for these younger kids was just authorized on November 2nd. And the way the FDA looks at it, if they've got a month or two's worth of safety data, they'll feel comfortable that a high rate of acute, short-term side effects are not there. So they'll authorize the vaccine. Generally, you wait a year to see if there's any problems in millions of cases or doses of vaccine before they'll fully authorize it.
Okay. Christian, if you want to, one thing that answer or that question suggests to me is you were explaining how mRNA works in this case with Pfizer's vaccine. I think several people, you were one of the first to mention Snapchat to me. Do you want to give us the quick explanation of it? Might help answer the long-term data question Because if you look at it from the science of mRNA, you have some long-term data.
Sure. The mRNA platform has been in development for about 10 years and has been used in other different vaccines for Ebola and other things. And it's really an ingenious way to make a vaccine. There are some vaccines where you just take a version of the virus and you put formaldehyde in it and then you inject it in people. And that's a very dirty and dangerous way to do things. And you can actually cause disease by some of those vaccines that use live or attenuated viruses. For example, the vaccine for yellow fever is one that's, it's just like a virus. When you use mRNA, you're not putting a virus in the equation at all. You're taking a very fragile molecule, mRNA, of which every human has billions of copies of mRNA within our own bodies. It's what we use to sort of send messages through the cells. And the beauty of the mRNA vaccines is they deliver instructions for that spike protein. They use our own cells to produce the spike protein, and then they're gone. And within, we think about 2 to 3 days, that mRNA essentially disappears. It's incredibly fragile. And just like it was there, it's gone, and you don't have these residual effects from mRNA. We think that platform is going to be used to develop a lot of vaccines in the future. It's now being trialed to use to make an HIV vaccine, which we've been struggling to make for 30 years with no success. And so that's kind of how safe it is. It's just there and it's gone. It's a very efficient way to tell the immune system about a potential dangerous pathogen.
Okay, great. Derek, I want to get to you, and thank you both for the background on virus and vaccine. Derek, I want to ask you, 9th District PTA President, I know that you are hit with all kinds of questions, and I know that some of them you've been collecting. So I want to hear from you about some of what you're hearing from parents.
Yeah, thank you, Mary. So Christian just touched on one of the big questions that we got, which was, how was this vaccine developed so quickly? I think it was 10 or 11 months from the onset of the virus we had the first vaccine in the United States. And I know it was with that mRNA technology. If you can touch on how it was done so quickly, and also John talked about how many children it was tested on, but maybe talk about that sample group and how long it was tested on children.
I'll start with how quickly things came to fruition, really from the time that the sequence of the SARS-CoV-2 virus was published online. I think it was actually 60 days after that they were able to develop the vaccine. And the reason they were able to do that so quickly is because several different other parts of science had merged and allowed it to happen. The vaccines are packaged in this sort of lipid particle, which is really just kind of a drop of butter, a way to deliver that. And that's been used in drug delivery for decades. I prescribe antibiotics and antifungals that are wrapped in those lipid particles as well. And then, like I mentioned, the ability to manufacture mRNA had been worked on for about 10 years. So that's why this is felt to be so valuable, is if we have another pandemic, and I guarantee we will, we've had about a new virus or pathogen emerge every 5 years or so throughout the last several decades, it's going to be very quick and easy to use this platform to develop new things.
John, do you want to add something about, I know you had a great slide that I've seen about was the vaccine, how the vaccine came about.
Right. So we had the sequence early on, and most companies that make the vaccine, including Pfizer and Moderna, normally wouldn't invest in a vaccine unless they knew they would get return on their investment, which is the way the system works. But if the government agreed to buy all your vaccine, whether it worked or not, and put money into all your research and build your factories, wow, it's like a dream come true for the pharmaceutical industry. There was nothing to slow them down. Everything they needed to move forward quickly, they received $20 billion in federal funds to help speed up research. So we had every available resource at our disposal. But once the data came in, the FDA took their time to review it. And I think we were all frustrated, it's taking so long now, but they didn't shortchange the review. The safety data and the emergency use authorization was not rushed, even though the vaccine was from the point where they first started it to the point that it was authorized was miraculously fast. Wasn't rushed, it was fast. There we go. Thanks for the slide.
Yeah, no,
that one.
I think that's very helpful. Christian, I know, and David, you were talking about this unprecedented bringing it to market, Operation Warp Speed, President Trump making this possible, essentially, that we threw every resource and all of the money that we had out of necessity, of course.
Yeah, I just want to mention that there is always a balance between waiting longer to get more information and just pressing go and letting it happen. And, you know, if we waited the normal process of a year or so to get a vaccine approved, we probably would have 2 to 3 to even 4 times as many deaths. And I think most people feel that was just unacceptable. That was the whole premise behind Operation Warp Speed, and why, you know, $20 billion of U.S. government money was put into this, because remember, we were locked down and we had no protection against this virus back then. Everybody wanted something quickly.
Yeah. I want to get to another question that we have from Ashley. If we have that one ready by any chance, Mark and Howard, let's listen to another video question from a parent.
Hi, I'm Ashley. I'm a parent of kiddos at Crest School, and I have a few questions for the panel. My first question would be, what is the difference in the testing that we've done for COVID vaccine compared to the vaccines that our kids are currently required to have to go to school? Like the duration of the test, the number of students, the efficiency of each of those. My other question would be regarding just right now, we're kind of told that we will have booster shots that we'll need to take for the current COVID vaccine. Are we thinking about those things with our students? Are we going to have to be prepared that our kids will have to take these vaccines continuously? And then my other question would be, it seems as though COVID is more of a respiratory virus, just like with the flu. We are not currently having to vaccinate our kids for the flu. That's up to parents' discretion. So what makes this case a little different than it would be for the flu?
Go, John.
John.
Great. So 3 questions. Great questions. So the FDA has a way that all vaccines are studied, and that's immutable. What they did is allow emergency use authorization because we're in a national emergency, and to prevent deaths, as Dr. Ramers mentioned. They authorized the vaccine before they would approve it. So all of the safety data, the numbers of patients that are enrolled in the trial are generally pretty standard. The duration of study was shortened, and that's why it's only authorized. It's not fully approved. So we need to go another several months before they get full approval. And boosters, perhaps, as we know, and I mentioned, the antibody levels drop down with time after vaccine. And we believe that breakthrough infections, even in people who are immunized, become more common, especially if you've got close contact to someone who's infected, and you can overwhelm the body's immunity if you really challenge it. So boosters are probably going to be something, probably annual boosters. And there's one company that actually has a flu and COVID vaccine booster that they're studying right now. So absolutely, we are looking at the need for annual shots.
Okay. I don't know if we're able to pull a question from one of our students. I want to mention our kids who may be watching tonight. I know a couple of our panelists have kids who are watching tonight, as you mentioned, but there are also some kids who are watching with their parents. And I know that we've had some questions that have come from some of the kids in the Cajon Valley Union School District. Chase is one of those. He asked a great question, and I think it's worth bringing to the forefront. Maybe if we can boost it up. And then Pauline, I would love it if you could answer it for us.
Hi, my name is Chase, and I go to school in the Cajon Valley District. I have a question for you. If I get that vaccine for COVID, I can still get COVID, transmit it to others, and still feel the effects of it. So why should I get it? Thanks.
Okay, I love Chase, first of all, with his full arm cast and everything. Pauline, you've been a part of this pandemic on the front lines and as a parent from the beginning. I feel like your perspective could be really helpful here.
Thank you. Chase, thank you so much for the question. I'm thinking back in the clinic and all my experiences in working and actually having to treat kids that are 12 and up. And I'm not sure how old Chase is, but thinking about how worried these children have expressed to me that they're worried that they infected their grandparent that they're living with. The concern, the look in their faces, I cannot even begin to describe how much more compelling that is for me to hear, and to reassure, these kids that I understand they're feeling really bad. They feel really helpless. They're really worried about their the grandmother that was probably just, we're having to send to the hospital because she contracted COVID because she was living with some unvaccinated children. So yes, you can certainly transmit the virus, and those are the things that we're having to deal with when the kids were unvaccinated at those age groups in our very own clinics. And we have had a couple of patients that have died, and I just want to share that, in our clinics that we've known because of transmission.
Yeah. Pauline, thank you. Kristen, did you want to jump in, or do we want to go to April next? Why don't we do April? I know we have so many questions, so many great questions. I mean, we couldn't possibly answer them all in an hour, but I think we're doing pretty well so far in trying to pass the information around. Why don't we do April's question next?
Hi, my name is April Adler, and I am the LCC PTA president. My question for the panel is, my child already had COVID and has natural antibodies. Do the negative vaccine side effects outweigh the benefits of getting the vaccine?
Okay, so the question is about natural immunity, and it comes up a lot. I have, my career is based on seeing people who have had their natural immunity fail. So natural immunity, while it sounds like a great concept, isn't a great solution in many infectious diseases. The natural immunity against HPV or chickenpox isn't very good. It doesn't prevent disease later in life and that type of thing. For COVID, there's been a lot of study of this in particular, and it is true that having COVID does give you some degree of protection, but it is highly variable from person to person. It fails a lot of the time. And what I mean by that is some people still get hospitalized and some people still die, and some kids get this multi-system inflammatory syndrome where it's actually their own natural immunity that's causing the whole problem. And then finally, we don't have a really great way of testing for natural immunity. John mentioned that we can send an antibody test quite easily, but that antibody test is a very inaccurate representation of true protection from the disease itself. And so we're not quite willing to say, okay, well, if you show me an antibody, then I think that you're in the same place that you were if you were vaccinated. We're just not quite there and not able to say that yet. So if someone has had COVID, we consider that about the same as getting a dose of a vaccine. It's going to protect you some, but it's not going to fully protect you. And what we've seen is people that have COVID and then get vaccinated have the strongest protection of any of us.
Okay. Christian, thank you. I'm going to go back to you again, Christian, because I know this is something that comes up all the time when I talk to parents about vaccines, especially for kids, is the question of fertility. Does the vaccine lead to any sort of long-term side effects and consequences such as infertility? That's one of the, it's been called a fringe concern, but I hear it so often. Can you address it simply and once and for all?
Let me start with men, because this has come to light with a certain quarterback that has been concerned about fertility and taking the vaccine. The few studies that I'm aware of show that the sperm counts of men do not change at all. In fact, they go up after the vaccine, and sperm counts after having COVID go down. Okay, yes. So that's the data that we have on fertility in men. So it's completely false to say that it affects male fertility. In terms of female fertility, the best information that we have is that in women who were vaccinated versus women who are unvaccinated, the rate of miscarriage and stillbirth and complications is exactly the same. So there's really, when you look at it systematically, there's no direct evidence that the vaccine causes infertility. In fact, what we know is COVID itself does cause infertility, causes maternal death. We had one in San Diego. There's been one in San Bernardino County. These are tragic cases where a supposedly young and healthy woman dies and leaves her child an orphan. And so the disease itself does cause a lot of fertility concerns. And this is why the American College of OBGYN has very strongly recommended that pregnant women get vaccinated. So the CDC has been tracking this and studying it. And when you look at things systematically, there's really no evidence that the vaccines cause infertility.
Okay. John, do you want to add anything there?
No, I am in complete agreement, and every statement that's come out has documented that that fertility isn't a problem, and actually COVID in pregnant women is increases your risk of death. So absolutely.
I want to mention too, we have a list of resources that we're going to be sharing in the Facebook feed as well as at 10news.com so that you'll have it in the future. One of the best pages is the misinformation page on the county's website that helps to sort of get you to the right information and steer you away from a lot of the misinformation that's out there. It's a fantastic resource. And we have a whole bunch of resources that we're going to be sharing with you. We have a slide that's coming up that'll have all of it. But of course, most of you aren't there with pen and paper. So we know that putting those links in the chat will be ultimately the most helpful for you. You can also go back and watch this entire video or the portions that are most pertinent to you. And I think we maybe have time for a couple more questions before we wrap up. If we can be quick, let's do Mike, who is a dad in the district.
My name is Mike. I have a second grader at a school in this district. And my question is, what are the steps to take a vaccine from emergency use authorization to full approval from the FDA? And would it make sense to wait?
Good question. A lot of those that we get. John?
Yes. Authorization is what they do if they have short-term data on safety and effectiveness. And actually, when you get an authorized vaccine before it's approved, you have to sign that this is not a fully approved vaccine. And then once they have more complete safety data, then it gets fully approved. So it's a time-honored process that you can the approval only comes when you have more information. The risk now for authorized vaccines is that if you don't vaccinate your child, you are putting your child at risk of getting coronavirus, and certainly things like myocarditis from coronavirus and MIS-C that Christian had mentioned. Probably 10% of kids with coronavirus get some heart problem. And there have been professional athletes who've collapsed during play from probably heart infection. And so that risk is maybe 5 to 10%. The risk of getting myocarditis is 1 in 15, 20,000, even for adolescent males. So why wait? You don't want your kid to get coronavirus. You can protect your child by getting them vaccinated, even though the vaccine isn't fully approved. It's authorized, so you can get it, and all the professional societies, American Academy of Pediatrics, American Academy of Family Practitioners, everyone is recommending it now for these kids.
That's great. Thank you. Derek, I want to jump to a question that I understand you just got via text that I think is, I think it's a universal concern for so many parents. Would you mind?
I do. I think it's great. And, as parents, our number one job is protecting our children. No one will ever doubt that. So this question was, I have valid concerns for vaccinating my children, but I'm afraid that if I ask my doctor, they will judge me for asking for advice. So for the 3 medical professionals here, can you speak to that and if you are encouraging families to talk to you and how you're handling that situation?
I can do that. We at Family Health Centers, when the vaccines first came out, we're talking really end of last year, we had a rush of our healthcare workers to get vaccinated, 70% right away within the first month or so. And we were a little surprised it wasn't higher than that. So I gave my cell phone to every employee and said, please call me if you have questions about the vaccine. And every single one of them had a different valid question. And it did not help at all for me to say, why are you not getting vaccinated? It helped to listen. So our job as healthcare providers is to listen. You as families have trusted your pediatricians to vaccinate your kids. It's what they do. Pediatricians are expert vaccinators. and expert at having these conversations about risks and benefits. So I cringe to think of someone being judged by their pediatrician. They need to be able to get the information they want and have an open, honest conversation.
I'm completely in agreement. I am actually upset and frustrated that someone's healthcare provider isn't going to talk to them about the vaccine or judge them. At Rady Children's Hospital, we have every healthcare worker, no matter what they do in the entire organization, has access to us to ask questions, and we answer each and every one. So whoever asked that question, Derek, have them send to you who their healthcare provider is, and Christian and I will call them up and share our thoughts with them.
Well, to be fair, I don't think they were saying they were judged. They were afraid of being judged.
Okay.
Which I think we can understand.
Well, and there are many parents, many families out there who don't have a trusted pediatrician, who don't have a family physician, who they do feel comfortable, or maybe perhaps there's a language barrier. I mean, there's so many reasons. There could be intimidation in play there. So which makes this panel and answering these questions that much more important, that there could be people who simply don't have someone that they could go to and ask these questions, no matter how off the wall they think they might be.
Right.
Let's see. Did you want to say, I'm sure you see a lot of this, Pauline.
I do. I do want to also mention that we as professionals, we are trained to listen, just like was mentioned already. But we also understand that this is a very challenging time, and we're all in a unique situation. We understand that people are anxious. We understand that people are fearful. We understand that these questions are going to come up over and over again. And again, our job is to listen, and we knowing that, and I think people should really we're expecting that, and so we welcome those questions, we welcome the conversations, and that's exactly what we want to do, is have a dialogue.
And if I may say, the vaccine rollout for the pediatric vaccine is designed that the vaccines are given by your primary healthcare provider. So there's no big mass immunization, no Petco part, send thousands of kids here. We want each of the pediatricians and healthcare providers, clinics, to provide vaccine to their own patients. That's the safest way to do it. And you have direct access to that care provider. So there should be two-way dialogue. Thanks.
That was a great point. That was a great point to mention. Angie has a question for you, David. Will you let parents have a say if our children will get the vaccine or not, but still be able to get an education in our district? If children do not get this vaccine, will they be discriminated against in this district? I think that's a really brave question from Angie.
Just about 100% of our decisions that we've made throughout the pandemic have been a result of our parents' input, their wants and needs, and what they've shared with us in terms of how they want to be served through this pandemic. And that's why we opened our schools. That's why Pauline came back and was able to bring her children back in April of 2020. So flexibility and choice is something that we've tried to do through every stage of the pandemic, and we don't intend to change that. What I have seen is, based on the Facebook Live feed, based on the input that we get every time we put out a communication, someone's angry at us. But the alternative is to not communicate at all. So what I can say is that we want to do things that are inclusive, that are not divisive, and these mandates and executive orders have caused division and polarity and a really rough environment. We need to provide options for all parents and children to feel that they can be safe, that their ideas and that their decisions about their own personal beliefs can be honored. And that's what we intend to do. So absolutely, your children will have a place here.
I love that. That warms my heart a little bit, just to hear that and just the fact that we're having this conversation, this dialogue, and that it was your brainchild to bring this together and to make this happen. If we have a couple more minutes, I want to try and facilitate just a couple more of these questions that we've received from parents. And Derek, I think you made the point that we've seen, as you collected questions, we've seen they fall into very similar patterns where we've seen the same question come up over and over and over again. Is there one in particular? I'm looking to see. We have a good one from Sarah. We have a good one from Chrissy. If there's one in particular that we haven't gotten to yet, Derek, that you really want to get in there. It doesn't have to be a video question, but if there's one that jumps out at you.
Well, how about this? I'll ask a question that I got via email a lot, and in the meantime, we can look for one of those video questions. And that is, since everyone in our schools are required to wear the masks, is it okay if I wait on the vaccine?
So I admire David and his position. My wife works with principals and superintendents a lot, and it's not an easy place to be because you have the needs of parents, you have the law, and you have the district and the school board that's giving you all different directions. But the best thing to do is to use a combination of interventions. And as I put on that last slide, the Swiss cheese, that there's some of those things that are easy to do, like ventilation, or like spending more time outside. And then we have things like masks, and masks are not perfect, but they're really good. The data that we have is that it reduces transmission by 30 to 40% from the CDC. And places that have had universal masking have been able to stay open a whole lot longer than other places that don't. Vaccines are another tool in the toolkit that can really help us decrease the risk. And vaccines are probably the most controversial because that's where the mandate comes in, and that's where the governor's order comes in. But as far as I know, there's going to be no mandate until full FDA approval occurs. So that only right now is in place for those that are 16 years and older, and is not in place at all for those age 5 to 11. Right now, if you have a 5 to 11-year-old, you can get vaccinated if you want. And we are encouraging you to talk to your pediatrician about that. But none of that, correct me if I'm wrong, David, will be enacted until full FDA approval, which is likely to be probably next year.
That's right. And according to the 2015 law that Senator Pan put into legislation when he introduced the vaccines that are mandated, he put a clause in there that any new vaccine would have a personal exemption. And again, we fully plan to honor the personal exemption here in the district for parents to opt out.
I think it's a great discussion. Should we look for another question? We have a good one from Edith, if we have that video by chance ready to go.
Hello, my name is Edith Hernandez and my son goes to Bostonia Global. My question is, what's the difference between the vaccine for adults and the vaccine for children?
Great one.
That's an easy.
Our resident pediatrician, John,
Yes.
that's a quick one.
It's the same mRNA. It's a third the dose, 10 micrograms rather than 30, and they've been able to put it together in a stabilizer that you don't need -70 huge refrigerator freezers to keep it. So it's a much more stable virus, but it's exactly the same, just a third the dose.
That's great. How about Chrissy? We'll kind of do a few of these as rapid fire as we can to try and make sure we get as many in as possible.
Hi, I'm Chrissy. I'm the Blossom Valley PTO president, and I'm the VP at LCC's PTA. And my question is who on the board or panelists, is the panelists or board, whatever you guys are, who is for vaccine choice in schools, who's an advocate for that? And my second question is, are there any students who you believe medically should be exempt from getting the vaccine? And if they have an IEP under the IDEA Act, can parents ask for exclusions? Thanks.
I'll take a stab to start on this, John, and then hopefully you can cover. So vaccine choice, as I just said in the last question, nothing is going to be mandated until full FDA approval. So your choice right now is to not get vaccinated. That's going to be respected, and I think David has said as much. For other vaccines, though, the law does dictate that for school enrollment, there are 9 other infectious diseases that we've agreed on as a society that are a requirement. So we may get there at some point in the future. You actually don't have vaccine choice, and it's a balance between the public good and your own individual freedom. And I've just thought of many different examples, such as drunk driving or smoking a cigarette on an airplane. You can't do some of these things because the public health actually trumps the individual freedom. You're not free to walk around and kill people or spread infectious diseases to them, such as tuberculosis or other things. So that's just a rule that we've kind of agreed upon in society. And then finally, regarding medical exemptions, really right now, the only medical reason why a child or an adult should not receive a vaccine is an allergy. being allergic to one of those things. And in fact, most of the things that are brought to us as, well, I don't think my child should get a vaccine because they have severe asthma, or they have a peanut allergy, or they have cancer, those are reasons that make them actually more vulnerable to COVID. And so we generally would not want them to go unvaccinated because their risk would be much higher.
That's excellent. We're trying to keep the schools as safe as we can for all the kids that come, and having vaccines is one way that parents can send their kids to school without worrying that they'll come down with infection. So I'm in complete agreement with Dr. Amers.
Sorry to jump in. I pressed David on this before about peanuts, and peanuts is a important issue for schools. And what we do with peanuts is we have a peanut-free zone. And that's because there are a small number of kids who have severe peanut allergies and their lives are threatened by peanuts. And so we as a society agree that you cannot, no matter how much freedom you want to eat peanuts, you cannot bring in peanuts because it's going to endanger the life of another child. And the cases that are going on in court right now in Texas with the mask mandates and everything are trying to honor the rights of those that are the most vulnerable, the disabled kids and the kids with the highest risk.
I just want to point out that so far you've given us Snapchat, Swiss cheese, and peanuts. So you're killing it in the metaphor game tonight, Christian. I very much appreciate those. They bring it home, truly. Do we want to do a couple more before we kind of wrap things up? Maybe, Derek, what were you wanting to go to next, or David?
Let's get Gunnar and Joel, student and another father in our district.
I love hearing from the students. Okay, Gunnar, your turn.
Hello, I'm Gunnar, and I am a 6th grade student at Crest School, and I have some questions for the doctors. Do you support a choice for the vaccine? Do you think this vaccine should be required to attend school? What does this shot do to my body? Do you feel myocarditis is an issue? And for my final question, what would happen if a student were to get really hurt or die from the COVID shot? Thank you for your time, and have a good day.
Gunnar's got a lot of questions. So I think we kind of answered the first two, but he talked about what it does to your body. I think that would be a good place to start. Maybe, John, do you want to take that?
So the side effects of this vaccine, probably because it's a lower dose, are much less than in young adults. It's about a third of the side effects. So headache, fatigue are not very common. Feeling flu-like is like a third in kids compared with adults. So it's a safer vaccine. It's just as immunogenic. It causes just the same amount of antibody response, so it protects you just as well. And we've touched on myocarditis. You're at far greater risk from the disease itself, or the multi-system inflammatory syndrome that you can get after COVID, even if you have mild COVID. And there have been no kids who've died from the vaccine. And Gunnar, I want you to know that I pay attention to that. And if kids were dying from the vaccine, I wouldn't be here recommending it.
Yeah. Important to mention. I know we had a question from, I think Joel's question was the same, who was the parent. Is that right? He asked about side effects as well. So I think we kind of addressed that one. There was one from Mabel, I think, that I saw too. That could be a good one. And now I've lost track of it. Do you have Mabel's question handy? I'm looking, I'm going to put my glasses back on, make sure we remember there was. I don't think it was a video.
Howard put it in the chat.
Oh, thanks, Howard. Howard and Mark, ladies and gentlemen, our Making This Happen team behind the scenes. Thank you. Mabel asked, she has 2 children at Rancho San Diego Elementary. Skeptical, what would you say to people who are skeptical of either the vaccination or mask wearing to stop the spread? And that also, John, one question that I had for you, we spoke about before we came on the panel was, would you say wait for the other vaccines? Or would you say go ahead with Pfizer? So I'll kind of lump those in together. People who are skeptical of the vaccine, people who are skeptical of wearing masks, and then also people who maybe say, I'd rather wait for one of the other choices of vaccine to come available.
So the pandemic is on. COVID is spreading in San Diego County. and kids are now recognized to be a major source of that ongoing community spread. So in order to improve conditions for all of us so we can get back to normal, we really need to immunize school-age kids. That's a critical group who these kids get around. They're out playing together, parties, sports. They're just social, and boys and girls. And so they're not going to be wearing masks when they're outside of the classroom. So they'll spread it. So if you're not wearing masks, then vaccines are the best way to prevent the spread. So I think that's pretty clear. And there are other vaccines, Moderna, which is falling behind Pfizer, but it's exactly the same kind of vaccine. So I don't think you get any benefit by waiting for Moderna. The Johnson & Johnson Janssen vaccine is an adenovirus vaccine, and we can talk about that later. It's actually not quite as effective as Pfizer or Moderna, so I wouldn't recommend that to my granddaughter or grandson. And there are other traditional vaccines. I want everyone out there to know that probably, within 5 years, there'll be 4 or 5 other completely different kinds of vaccines. But I'm not going to ask you to wait and risk your child getting COVID for 4 or 5 years until the new vaccines come out. But for those families that are having young children, just keep looking out for all the new vaccines. And it may be that the second generation of vaccines will be even more effective and safer. And no one will even remember Pfizer 10 years from now because we'll have other vaccines. That's the way the system works. We get the safest and most effective, and that's the one we recommend.
Like that. Okay. Thank you. I think we have Melissa, and I know we've gone over the hour that we had. We will make sure that you have the resources if you do need to drop off. Obviously, we know that not everyone can stay with us for the full time, but we want to make sure that we get as many of the questions answered as possible. And we know it's not possible to answer all of them, but that's what we're trying to do, is kind of get through as many as we can. And while we have our experts here, Melissa, I think Melissa sent in a video. Is that right?
Hi, my name is Melissa, and I am a parent at Cajon Valley. My question is of 2 parts. Why is natural immunity not a topic of research and discussion? And with such limited time that the COVID vaccines have been out and the need for boosters within months of having what is considered to be fully vaccinated, how is it that it can be said as though it is factual that the vaccines are more effective than natural immunity? Thank you.
I'll take this one and say that. So I talked about natural immunity a little bit before. The real answer is we don't really know yet, and there's lots of studies that are going on, and they're kind of confusing. Pauline and I have certainly seen people that have gotten reinfected, where their natural immunity fails them. There's data from the state of Oklahoma that's very closely tracking reinfections versus breakthrough infections, people that have natural immunity versus people that have vaccine-mediated immunity. And it looks like the people getting reinfected are happening twice as commonly as breakthrough infections. So that would say that maybe natural immunity is not as good. There's also data the CDC published from 9 states that said that people were 5.5 times more likely to get a reinfection than a breakthrough infection. And there's data from Israel that's not published yet, but it kind of shows the opposite, that natural immunity is better. I think both of them do actually give some level of protection. In fact, the world's expert in natural immunity is in San Diego, Shane Crotty, who's at the La Jolla Institute of Immunology, and he published the first studies of natural immunity, and it shows that it fades with time, just like vaccine-mediated immunity. We don't know if, I'm a little less sure than John is about, we don't know if boosters are going to be necessary. I think people are looking real time to see if that's really the case. And the United States decided not to recommend boosters for everybody right off the bat. I know Pfizer is asking for it, but it's older people that need boosters at this point right now. So again, we're watching this very, very, very closely and trying to see which is best. But for the reasons I stated earlier, betting on natural immunity is a risk. You're risking long COVID. You're risking, so not getting vaccinated is actually an active choice. You're putting your individual at risk. Getting natural immunity plus the vaccine is the best, even better. So for people that have already had COVID, getting vaccinated on top of that will protect them even more.
David, I know you had a question too. I'd love to hear your thoughts on all this.
Yeah, for the panel, just in reflection of the dialogue, from the beginning, we made it a point to listen to our families. I've met with over 3,000 families in the last 12 months, and that's the best use of my time because I get to know what they think and feel about what's best for their children and how we should make decisions. And in the beginning, it was easy. You know, I want my child at home distance learning because I don't feel safe, so we made that option. I want my child at school. Please open them. We opened our schools early on in the pandemic, invited our kids back for parents that wanted that. At this point, based on the feedback and input we're getting from parents, there's a lot of uncertainty. There's still a lot of mistrust about the vaccines. It's obvious coming in from the feedback. And with 30% of our polling of parents that are actually going to get the vaccine now, that's not very many. So from our panelists, our medical experts, how do we start to exit the pandemic? All of us have pandemic fatigue, and there isn't enough information. And I'm not going to ask parents to do anything that they believe will harm their children. We just won't. So how do we get to there? We're hoping this panel would be an opportunity to edify, to just answer facts about what it is, and is that enough? What's next? How can we start to come out of the pandemic, lose the masks, lose the protocols, and return to normalcy?
So it's an easy question to finish us off on. I think anybody that says they know what's going to happen is just being foolish because we don't know. And this virus has been so unpredictable. Let me just briefly name the ways. We thought it was a respiratory virus, but it causes all these other mysterious things like blood clots and brain fog and post-COVID. We are seeing people that have asymptomatic infection and spread without even being sick at all. And then we see people that are perfectly healthy getting very, very sick and dying. So we're not very good at predicting that. We had great hope that our vaccines would be fantastic at 95%, and we're starting to see that they're fading. We thought we were going to be able to get to herd immunity like some communities in South America did, and then they get wiped away by a second wave, but by a new variant. So I don't think anyone can rightly say that they know what's going to happen. But I will say that it's probably not going to be any one thing that gets us out of this. It's probably going to be a combination of smart things that we can reasonably agree upon to get as close back to normal as we actually can be. And like I said in the Swiss cheese thing, it's going to be being outside more and maybe having masks until community transmission goes lower, and vaccinations for those who will accept them, and testing. We need to do all of the things to really get us back closer to normal.
John?
I see a lot of these kids who end up in the hospital with COVID, and the obesity that Dr. Ramers mentioned is 80% of who we see in our ICU, obese adolescents. Kids with asthma who with every cold they get end up with horrible disease and come in. Well, coronavirus is just another one. So my picture to get us back to normal is to immunize these kids and decrease transmission so that kids can get back to everything they do in school and around school, plays and sports, and not have to worry about transmission. And just one other piece of information that Christian touched on, which is really important, is that we still don't understand everything the virus can do. And those ACE receptors that the virus uses to get onto your respiratory cells are also present in the brain. And if kids get coronavirus, I have some worry that a certain percent will have some brain fog. And you know, how do you know if a 2-year-old has brain fog or an adolescent has brain fog? I mean, it's really—
Don't they all?
No, thank you. I wasn't going to say that. And the studies on long COVID, which would look at brain fog, are only now being started. The NIH just is starting all of those studies. So there's a lot of reasons to protect kids from the virus and get us all back to normal. Thanks for the question, David.
Thank you, David. And I think our doctors explained it very well, all the responses. And I just wanted to add quickly that, you know, we can continue to just use our resources and tools that we already know that have been proven effective, and just continue on with that.
Thank you. Thanks, Pauline. I think that's going to be all the time that we have for questions. We know we have more questions. So for those of you who've submitted them we're going to post the questions and the answers. I know Cajon Valley has a page that was dedicated to this panel and the Q&A. And of course, it's also available at abc at 10news.com on our website. So we'll leave it up there so you can continue to watch it. We also want to share some resources here momentarily. But before we really conclude the discussion, I'd appreciate it if we turn toward something that we all are hoping for, whatever that might be. And it can be, we started to go there, but in the interest of making this a positive dialogue that is inclusive, which I think we've done so far, I'll turn to each of you. What is each of you hopeful for going forward as we talk about the vaccine, as we talk about getting back to quote unquote normal? What are you most hopeful for as you look ahead? Who wants to start? David, why don't I start with you?
I'm hopeful for civility and that we can bring people together and coexist with different opinions about what's right for our children and for our schools. And we've been able to do that here in Cajon Valley. I will say that we've been open for 19 months since the beginning of the pandemic and still have zero in-school transmission of the virus. And so safety and protocols do work. And I'm hopeful that we can continue that.
That's incredible. How about you, Derek?
I'll take it somewhat personal. If I look at my two kids, last year was a rough school year. This year, a little bit better. My oldest daughter will be a senior next year. I hope it is somewhat normal. Our youngest will be finishing up middle school. I hope it's somewhat normal. I think every parent, that's what we want. We want our kids to be able to enjoy school like we enjoyed it. Because as much as we didn't say so then, school is fun. It's an important part of our kids' life. And I agree with David. The civility of everyone to come together and make that happen for our children is second to none.
Pauline?
I hear a lot of patient stories, and I hear a lot of people's stories from different backgrounds and perspectives, different lenses. So for me, I'm really hopeful that we all come out of this with a deeper sense of compassion, deeper sense of empathy with one another, really hoping that we can continue to open our hearts and minds and continue to listen and just be able to have to make informed decisions.
Christian, you're up.
So I like what David said. I'm hopeful that we can find common ground and really move through this together. And I think the easiest thing that we should be able to agree upon is that in-person school is the right thing to work towards. And hopefully we've talked about the different layers of things that are each partially effective. Nothing is a silver bullet, so to speak, but just finding the right combination to get as close to back to normal as we can. The other thing that gives me hope is I really don't think we're going to be in a place where our hospitals are overwhelmed. And that's because the more that a community is vaccinated, the more we see this disease as a mild to moderate disease, and it's not putting people in the hospital and killing them. In places that have had relatively high community vaccination rates, even if the cases are going wild, the hospitals are not full and overfilling in our ICUs. Individuals are certainly getting there, but I don't think we're going to see like we saw in the winter of last year where all of our hospitals were full of COVID patients, and that gives me hope.
John?
So I want to touch on something that is hard to quantitate, and that's mental health of kids. And I've seen my grandkids, Derek mentioned it, they're not meant to be locked up and isolated. They're meant to be out there with their friends. And we're just now looking at the toll of unsocialization of this whole set of kids who are growing up without friends, always wearing masks, not going to parties. And we need to get kids back to enjoying life. The number of suicides in teenagers is skyrocketed. We've even opened up an extra section in our emergency room just for behavioral problems because they're so common. Stress in these families when they're isolated and can all go away if we can protect everyone. And the vaccines, I think, are one of the most effective ways to get us back to normal. And I want to see kids playing out there on the playground and having a good time again. So So thank you for asking the question.
Well, and I know, John, I saw you the day that, or the morning after it was approved for this age group,
Yes.
is when we met outside of Rady Children's Hospital. And my photographer is the one who said to you, this was the happiest, the most enthusiastic, and the most excited that he had seen you in this entire time. So I think that
it's true. This is such a benefit for kids. It will get us back to normal. And I was particularly enthusiastic, and he picked that up, and I'm overjoyed. To get kids safe and enjoying each other again is a huge goal for all of us. So yes, I'm glad he pointed that out, Mary.
Yeah,
Thank you.
it was real. It was genuine. So thank you for that. I want to take the time to say thank you to everyone who's been participating, whether you're watching from home or you're on our panel. And I want to mention the resources that we have. If we have the slide up, I know we said that some of these websites were lengthy and wordy and perhaps not useful in their existing form. But you can see there that among the list of resources is vaccine ingredients, CDC information and data, where to make an appointment, as well as facts and myths about the vaccines. You have a little bit of everything in these resources, which will absolutely be included in the chat below. And it will be on our website as well at 10news.com, and also on the website for Cajon Valley Union School District. So with that, I will conclude our panel tonight and this incredibly important conversation that we've had. Thank you to our panelists, all of you, for your expertise and your time. I know that it's incredibly limited and short right now, and it's been a wonderful conversation. I think it's been an inclusive conversation, and hopefully we got some answers for people who are looking for those answers about their children. And so John and Christian and Pauline, thank you. Derek, thank you so much for helping bring this to a larger audience. Thank you, David, for putting all of us together. And I want to thank Howard and Mark, our behind the scenes team, for their technical expertise. This could not have happened without both of you. This has been a wonderful dialogue. So thank you to each of you. Thank you for being open and willing to participate too, and for sending in your questions and for listening to the answers. Anyone else want to say anything before we close out other than thanks? And we'll all.
Thank you, Mary. Thank you for
my pleasure. It's my pleasure, really. Thanks for this conversation, everybody. Have a great night.